Welcome to our webinar, An Alternative Approach to Qualitative Research, Combining Technology and Human Connection. I am your host, Monica Gilson, the Marketing and Events Manager for M3 Global Research. I am joined by two colleagues today. Laura Haxton-Wild is our Head of EU Qualitative Research. She joined M3 Global Research in 2018, bringing over 16 years of experience in international healthcare fieldwork. Laura is responsible for the continued growth of M3's offering for virtual, online, and in-person qualitative research across Europe. Laura is particularly interested in using innovation and technology to increase respondent engagement. Brooke Allen-Watson is our Director of Qualitative Research. Brooke is responsible for the daily operations of our U.S. qualitative team. With over 17 years of experience in the qualitative market research, she's developed our qualitative department, sharing her specifics of online, in-person, telephone research, and any other out-of-the-box methodologies that keep market research interesting. Brooke also presented on our June webinar, Patients, a New Perspective Within Healthcare Market Research, which is available for viewing in the resources section of our website. Our presenters will be taking questions at the end. You can submit them anytime during the webinar by using the Q&A function. If you have any technical difficulties, please use the chat function. Both of these options are available in the webinar console. I'll now hand it over to Laura and Brooke to get started.
Thank you, Monica, and thank you all for joining us today. As Monica mentioned, we're going to be talking about our approach to qualitative recruitment and field management, and specifically looking at how we leverage technology to ensure efficiency and compliance whilst maintaining quality and creating a great user experience for our market research participants. We'll be looking at that technology that we mentioned, as well as recruitment and scheduling, validation and quality control, these elements in a practical application, and the benefits of this method.
Thanks, Laura. So we'll first be taking a look at an overview of the method, how we use panel and automated processes where possible, and also increasing efficiency along the way. M3 has a proprietary market research system that we call Qualitool, and it manages everything from bidding to invoicing and all of the fielding in between. Of course, the cost and the maintenance of a proprietary platform doesn't work for all companies and all situations, but there are definitely other cost-effective resources out there that can assist with some of the tasks that go along with qualitative market research. When we started to build our qualitative department a little over 6 years ago, it was designed from an existing quant platform, so online surveys. It was definitely scary to me personally, coming from the pen and paper world of qualitative research, but it developed into something very user-friendly, fast, and efficient. And the tool also evolves as we grow as a company, and obviously new technology is emerging. But what if a proprietary tool isn't part of your company profile? There are a ton of other automated platforms out there that can assist with qualitative research tasks. For example, one of the popular things right now is text message reminders. So, these are reminders to send to respondents for making sure that they are ready for their qualitative engagement. There's a platform called Easy Texting that I had a chance to preview. Very user-friendly. You can set it up that matches your qualitative appointments, also schedule reminders to go out. Google Calendar or Google Sheets, I love these platforms. They're very user-friendly. Again, they can be used for respondents, but also for clients who are listening to your qualitative interviews, or moderators to help keep their schedules aligned with their day. Outlook Scheduling Assistant, this is another very useful platform that you can use to send invitations, again, both sending to respondents, moderators, and clients listening. Online screening, this has been around for quite some time now. Some companies use it for full online screening, others use it just for pre-screening and then do the full screen over the phone. Platforms out there like SurveyMonkey, Confirm.it. These are all very helpful and useful, and also really helpful for the respondent to take the screener quickly. I should just pause for a second and mention that I don't want to plug any particular platform or service over the other. The ones that I'm mentioning are just ones that I've used over the years, personal preference, and there's a ton more to choose from now. Looking at some other platforms, screen sharing. So this is a popular methodology for qualitative research, or if you have some sort of stimuli or something you'd like the respondent to view. We use JoinMe. I like the JoinMe platform because it doesn't have a download, where some of these other platforms require a download on the respondent's end, and it can cause some issues or delays. So JoinMe is one that's just a web-based platform that you can easily share stimuli or other materials. Zoom, obviously we're using that today for our webinar, and there's other platforms out there as well. Looking at web assistant interviews, the interview platform is very helpful. Online bulletin boards, 2020 eye tracks, they're all helpful for moderators and also respondents' ease of use. And there's transcription services out there now that have all these tools for keyword tags or summaries that can really help with that report writing stage. There's a few others that can assist with live interviews or data analysis. I recommend, just doing a Google search for whatever platform you're looking for, or even asking other qualities, on the Insights Association blog, for example, just putting it out there and seeing what advice others may have.
So recruitment and scheduling can be one of the most time-consuming parts of qualitative research. Organisation is key. When you're running projects across different time zones with multiple stakeholders, it's crucial to make sure you have all of your ducks in a row when it comes to scheduling. My go-to site is timeanddate.com. I know that Brooke uses timebuddy.com, and there are plenty of others available, either online or as apps or as functions on your phone. Diary management is a constant challenge for everyone with busy personal and professional lives. So we make sure we use calendar invitations for moderators, clients listening in, and the respondents to make sure that we have that important time in their diary blocked out for our project. It's human nature now to need appointment reminders in all of our busy lives, not just for the researcher, not just for the client, but also for our respondents. And this is where we find text message reminders come in incredibly handy. For our spreadsheets or client updates, these make sure we are updated in real time with columns to note which elements have been confirmed, any changes, whether it's with who your simultaneous translator is, which of the moderators is available, all of those different iterations to make sure that everyone is in the loop. Large multi-country projects can get confusing when there are multiple changes, so staying on top of things and having a clear schedule and a clear way to record that is really key. For us at M3 in the healthcare space, this time saving and efficiency is ideal for our target audience. We're working with busy physicians and nurses and HCPs, so trying to screen and book appointments with them and rescreen them in between them seeing patients. We have to make sure that it's an easy process for them and that it's quick with minimal recontacting from our side. And this is where we really try and use automation and technology where it makes sense, covering off a lot of admin tasks so that we can spend more time with our clients and problem solving and progress chasing on the project rather than spending a lot of time sending confirmation emails.
Validation and quality control. So this is where the human element cannot be eliminated. I can think back a decade or so ago, there was this big scare that focus groups or in-person research was going to be replaced with the technology, and it just hasn't happened. Yes, the travel budgets may be less than what they used to be, but in-person research is better than ever, and it's enhanced. It's qual research, so that human connection and the interaction is not going away. We're just adding to it with the technology to assist what we've been doing for years, and maybe even giving us some time back in the day, if you can imagine that. So for quality purposes, we still need to speak with each respondent we recruit for qualitative research. It's important to rescreen on any key criteria that was given in an online screener or pre-screener, or even verify the information that was given to the phone recruiter if it was a phone recruit. And not everyone is the best fit for qual interviews. We can all think about our horror stories or certain respondents that you may have interacted with over the years that it wasn't a good fit. So the rescreening and the phone confirmation part of this whole process is just crucial. If you happen to join the patient webinar last month, you learned for patient research that we do a validation to get a copy of a prescription or a physician note to validate patient screening info. This is an important part just to make sure, again, that the respondent is the right fit for your research. We also have system alerts that will note if a respondent still needs to be rescreened or validated before their qual interview. This is just something that helps us manage, not only from the project management side, but an easy way to track in an Excel spreadsheet so that you can also let your client know what's going on and keep yourself and the clients updated. And for new panel signups, it's really important to validate the people that are signing up for your research studies. Here at M3, they're validated through different data and security checkpoints, which Laura's going to get into a little bit later.
Thanks, Brooke. So now we're going to look at the practical application of this approach, starting off with recruiting. So once our study design is confirmed with our client and we finalise the sample sizes, the markets, and the all-important timeline, we get the screener programmed. Once the screen has been programmed and quality checked, and our quality checks have been completed and any required overlays into other languages have been actioned, it's then tested once more before we launch. We select our sample from our proprietary panel to send recruitment invitations out to, and responses are monitored through the online system and are analysed as completed surveys come in. Using this method is great because it allows us to be able to really assess the health of the project from early on. So if there is something in the screener which is causing a problem, number of patients or type of medication prescribed, for instance, we have screen out data easily available, and we can advise the client on any difficulties promptly as recruitment begins and make recommendations on how to proceed.
Being able to finalize the date and time while you have the respondent's attention and engagement is key. So when you are the respondent and you're taking the screener, having that ability to select your date and time in that moment while the respondent is engaged will be a very positive result. And we need to keep up with the technology to keep our respondents or panelists interested in what we're doing here in qualitative research. But it has to have that convenience factor. Convenience obviously is a part of everyday life. We have our cell phones glued to our hands. And we use them for appointment reminders and schedules. So this should be tied into qualitative research as well. So it's very important that schedules are confirmed before the actual screening is taking place. Confirming the times or availability for the moderator, clients if you have them listening in, this should all be done before the actual screening step. Obviously, last minute changes happen, things come up, emergencies, but you want to eliminate the back and forth for everybody to make the process smoother. So if you don't have access to an online scheduling platform, there's others out there. Google Calendars work great for this. We mentioned them earlier. You can use the Google Calendar link to share with the respondents via email. You can also consider programming the date and time in the screener and just have the respondent self-select from there. Both of these things will help increase efficiency and also the user experience. just having this scheduling automation has been a huge time saver for us, not only from the project management side, but it's also one of the #1 things that we get feedback-wise from our respondents, just saying how easy the process is, and they like having the convenience of having the schedule as soon as they are done taking the online screener.
The validation of participants is a crucial part of any market research study. When we get new panelists on board M3, upon registration, their details are sent off to be verified. So for our HCPs, our US physicians are validated against the AMA and MPI databases. And in the EU, M3 validate physicians' details on the local medical council. And as well as that, the physicians are asked to submit their medical credentials to our panel team in the form of a copy of their medical ID license, a copy of the diploma of the medical school, and a copy of their medical license. When we're working with patients, as Brooke mentioned earlier, the onus here is on verification of the condition. And we will verify that through either a copy of the respondent's prescription, a doctor's note, or depending on how they were recruited via an association or a physician referral, we may agree with our client on another form of verification.
My motto since working at M3 is you can do qual and still have a life, and it's true. Technology is a huge part of making this possible. We're moving at lightning speeds and trying to create the most efficient way of working to keep our clients, the respondents, and our team members happy. Sometimes we try out new platforms or methods and they don't work. Sometimes we roll out something and it ends up saving us hours of time, not only for our clients and our project management team, but also for the respondents. So it's definitely a trial and error process. Don't be afraid to pilot something, maybe if it's just for a few interviews or a few projects, and then evaluate the time that it saved you or your team members. Technology can be a scary thing, but it can also be life-changing. It can lead to faster field time, setup time, recruit time, just turnaround time in general. Many of the platform providers or services that I mentioned today, and of course there are others out there, they have free training and support. So I really encourage you to use it, not only for training for yourself or for your team, but also for clients and moderators. You just kind of tell them what your purpose is and what you're trying to achieve, and rely on them to teach you their platform and provide support as you go through all the different features. Technology is helping to shape our qualitative research community, and we're certainly all learning together.
Thanks, Laura and Brooke. We have time for a few questions, and if you have not submitted one yet, you may do so now using the Q&A function in the webinar console. Before we jump into questions, I wanted to let you know that following the webinar, you'll be taken to a quick 7-question survey where we welcome your insight on today's presentation. Our next webinar will take place on Tuesday, September 10th on Agile Research, Deliver Business Intelligence in 48 hours. We will include a registration link in the email of this webinar recording, so we hope that you'll join us. So our first question is, are there any technology restrictions with international markets?
Oh, I'll take that one because that's actually top of mind at the moment. So yes, you do have to be very careful with technology and international market research. So we have found specifically in Asia markets that the firewalls at the hospitals for physicians can prevent them from using some of the platforms. And it does pop up occasionally in Europe as well. So that testing phase with the respondents is so important, but just also knowing that different technology may not work the same in every country. It's just a reality of, technology and how the interweb works.
Great, thanks, Brooke. So that was our only question. If you have any additional questions or you want to reach out to us as the marketing team, we can route them. You may also reach out to our presenters directly. Sorry, everybody.
Oh, I see a couple of questions coming through. Let me just read real quick.
While Brooke's reading, just keep your eyes out for the recording of the webinar that will be sent to everyone later this week. And if you're interested, you can find all previous webinar recordings in the resources section of our website.
Okay, so this was a question about issues with Join Me. So yeah, I'm surprised to hear that. I mean, obviously it's technology, so things will pop up. If you are worried about having issues at a live qualitative interview, I do recommend offering a service that has like the live tech support. So Interview 2020, all of those platforms offer like a operator. Mercury is another one that we've used in the past that can kind of help troubleshoot issues, especially if you're moderating and you can't attend to the respondent. You'll have that technology aspect to help guide through the issues. But yeah, I'm surprised to hear about Join Me, to be honest, because of all of the platforms, that's the least amount of issues because there's no download. But again, if the respondent, if they have like a poor internet connection, then yeah, you're going to run into some issues there. And here's another question about, have you noticed any impact on attendance versus no-shows since using automated scheduling? Yes. Tremendous impact, and even better improvement since adding the text message piece, because obviously email was the first way that we went, and folks still use email, but the text messaging has been very helpful, and we still call as well, but the text message for a 15-minute reminder has been very helpful, especially in the healthcare space.
Well, all right. Thank you so much, Laura and Brooke. Thank you, everyone, for joining us, and we look forward to hearing from you on the survey, and enjoy the rest of your day.